You're watching TVC News. To Education Matters now. With the growing advocacy for reduction in the number of out-of-school children and access to quality education, the Center for Integrated Social-Economic Governance in Africa, on a visit to Gwalameje Primary School in Bauchi State, emphasized that individuals and groups must also support government's efforts. The Bauchi State government earlier this year announced that the number of out-of-school children in the state reduced to 521,000 from the 1.5 million reported by UNESCO in 2023.
Our school, it will improve our children learning, and another way, they have provide writing materials and also help the parents to put more effort for their children.
We are actually after supporting the community, and we are not particular about which community to go for. So for us to come and then inspect the school gave us interest. Yes, that is what inspired us actually. So we actually picked the interest based on our own supervision. We came and made our research, and we felt this school in particular is going to be a better option for us too.
There are things that need to be done that only government can do. Let me tell you, I always say this, the first place a child starts is in house. You start in your house before you go outside. So the training they give you at home is the training you take outside. A trained youth can change the youth outside. We always talk about people in government stealing. If you teach your child not to steal in the beginning, if you reach the government, you will be teaching those ones we cannot steal. So everything starts from the home.
Governor of Kwara State, Abdulrahman Abdulrazak, says his government's commitment to investing in technical and vocational education of youth. This is aimed at producing skilled professionals who will not only seek but create jobs. Ibrahim Alege has details.
The International Vocational, Technical and Entrepreneurship College, IVTech Ajashaipo, was established by the Kwara State government to train and produce skilled professionals in electrical and electronics technology, hospitality and tourism management, and information communication technology.
Thank you very much. I hope please be seated.
Of the total 410 trainees who got their certificates in various technical and entrepreneurship fields, 310 were sponsored by the state government under its Youth Empowerment and Employment Generation Scheme. Governor Abdulrahman Abdulrazak was represented at the graduation ceremony by the Commissioner for Tertiary Education, Dr. Mary Arinde.
This administration will continue to invest in technical education, youth empowerment and innovation. Our policies and programs aim to create a conducive environment for you to thrive, from access to credit facilities, from startup to partnership with industry leaders, and internship and mentorship.
The rector of IVTech, Dr. Saliu Yaru, disclosed that over 1,000 youths drawn from the 16 local government areas of the state have so far been trained through government interventions.
The college is seeking approval from the government to be recognized as a training center where professionals in the civil service workers, in the state civil service workers, can obtain professional certificates and diplomas for promotion purposes at their respective MDAs.
With the knowledge I've acquired at IVTech, it will be as a startup for me to establish myself, because I've been able to gain enough knowledge for me to stand on my feet and then proceed with my web development career.
I repair motorcycle and generators. So I have the desire to know cars, to know a lot of things about engineering. So I went online to search for a technical school that can give me more practical knowledge of engineering courses. So that's why I came here, and it was wonderful.
Startup packs were also provided for the graduates.
But beyond this, they are expected to be hardworking, committed and dedicated to their handiwork so that they can eventually become employers of labor. Ibrahim Alege, TVC News, Ajashaipo, Kwara State.
Well, still in Kwara State, ahead of the Ilorin Art Exhibition, enthusiasts are asking people to see works of art beyond mere painting, molding or sculpturing. At a press conference in Ilorin, the artist said it is time to project quality works in the state. Over 40 artists, majorly from Ilori, are expected to participate in the exhibition, which is the first of its kind in the state.
We'll be doing something like 40 plus works. The exhibition will run from December 1 to December 31. While the exhibition progresses, it will not just be about pictures. We want to have an opportunity to engage with the community. We will have special days which we'll dedicate to focus groups.
A learning artist must unite. We must think of a way in order to promote our own self and equally our product, so that if we are able to extend our talent from this place, at least other people from other states, we know something good is cooking in the state.
Art is life. Everything starts with art. Medicine starts with art. When you are asking them in the school, what do you want to become? Hardly will you see somebody that will say, I want to become an artist. Unfortunately, that is the beginning. That is the beginning. Look at the environment. Whatever you see here, the clothes we wear, everything is about art, but we tend to neglect it. We are changing the narrative.
Thousands of residents of Ifelodun Local Council Development Area recently benefited from a mega empowerment program put together by the council chairman, Olufemi Okiowo. At the event, which recorded large turnout of indigents in the community, home appliances, tricycles, minibuses, among others, were given to the people to alleviate their financial burdens. The former Minister of Defense, Musili Obanikoro, commended the council chairman and also urged the beneficiaries of the initiative to make judicious use of the items.
We're happy doing it as a council, because it's very important to state also that these monies were given to us to look after the people. Aside constructing roads, water systems, electricity and so on, aside those, we still also have to make sure that their living condition is better. So that's why we invested so much money in them. It's investment in human capital development, and we're trying to develop their earning capacity. So we expect that they will not go out there to sell it.
To improve their businesses, I think is quite commendable. And I'm sure those who have benefited today will see this as government support, as a support from the government to cushion the economic situation of the country today.
We are using this period to telling the chairman, say he's doing us better, Sha.
I say thank you and God bless him, and I know God as he's helping other people, keep them away from poverty. God has a plan for him, and he will take him definitely where he wants him to be.
So health matters now. Nigerians have been advised to love their eyes by avoiding poor diet, abuse of drugs, alcohol, and ensure they have a yearly check from an eye medical doctor from the age of 40. This advice comes as glaucoma rates in the country continue to rise. To help in addressing this challenge, a training program facilitated by a team of nurses helped to equip the nurses in mastering advanced diagnostic tools and how to educate patients about medications, adherence, and lifestyle changes that can help manage the condition.
The particular platform I am on is to train the nurses, to upgrade them so that it's not just going to be VA they're doing, for them to know more about the machine that we use, that the doctor are using to diagnose patients, like a visual field machine, OCT machine, autorefraction machine, eye care machine, tachymeter machine, and few more.
What we are trying to do is to improve the management of glaucoma, to reduce the number of patients who go around without seeing doctors, without seeing eye care practitioners. So when we have these nurses, who know what to do, then that can reduce the load in the clinic, okay? And the clinician, the ophthalmologist, can concentrate on those who required intensive treatment.
And then the ophthalmologists that take care of these glaucoma patients are not enough in the country. So nurses have to be stakeholders in participating in managing these patients. So some of the diagnostic management, some of the diagnostic procedures that are supposed to be done, so the ophthalmic nurses are now doing. That's why they engage ophthalmic nurses to train them. So the ones available here, after being the training, they are going to step it down to the other ophthalmic nurses in the country so that we have a wider coverage for the ophthalmic nurses, our glaucomatous patients to be having correct intervention and treatment.